Hello, thank you, Erica. I'm Chela Vázquez from UMASH. Welcome everyone to the workshop that focuses on the health and safety of immigrant dairy workers. Before I go on, I would like to ask that you answer to some poll questions that, and please answer them in your chat box. There should be some questions there.
So I think you click on the link that's in your chat box and you answer the polling question. Thanks, Heather, for putting that up there.
Thanks so much. I'm going to continue. I am going to talk about a UMASH project that focuses on the health and safety of immigrant dairy workers. And UMASH, it's a collaboration of several research institutions: Migrant Clinicians Network, the National Farm Medicine Center, the Minnesota Department of Health, the College of Veterinary Medicine, and the School of Public Health. UMASH is one of the 11 centers that are founded by NIOSH, which is the National Institute for Occupational Safety and Health, which focuses on the health and safety of agricultural workers and their families. Here is the outline of the presentation. I am going to talk about a training curriculum for immigrant dairy workers in Wisconsin and Minnesota. And also about the Community Health Worker Project, Promotores de Salud en Español. And I will also explain a little bit about the outcome of these trainings. And we also did a survey on COVID-19 and a query on the COVID-19 vaccine. So this is what I will present today, together with my colleague, Jonathan Kirsch. In the United States, dairy farms are going down in number. That's a trend, but they're increasing in size. And increasing in size demands a larger workforce. Most of the workforce in dairies are immigrants, mostly from Mexico, and some from Central American countries like Guatemala, Honduras, Nicaragua. The data shows that farms that employ immigrant labor produce 79% of the US milk supply. The immigrant workforce in dairies, most of them don't speak English, and they're relatively young, 16 to 45 years old. And they don't have higher formal education, most of them, but there are some that have. Now, I would like to ask again a question, and please put your answers in the chat box. The question is here. What injuries happen on dairy farms? ¿Qué lesiones ocurren en las lecherías? Can you please write your answers in the chat box? And Amy will help me. She will tell me what are the answers. Do we have anything?
Yeah, so we have shoulder.
I was muted, sorry.
Oh, go ahead.
Falls, slips, skid steer accidents, injuries from animals, back injuries, broken bones, getting kicked.
Yes.
And
Right. Those are very good examples. Yeah. Cows can kick, they can bite, they can do headbutts, they can pin workers. Workers have injuries sometimes when they slip from the skid loader, so they can be run over by the skid loaders. Well, that's many injuries, opportunities for injuries in dairies. Thank you very much for that. So we have here examples. Sometimes the injuries can be fatal, and injuries also can happen. They may not be fatal, but they can really affect the worker. So here's some examples, some pictures. I'm presenting here some data from Wisconsin because the project that I am talking about, the curriculum, the educational curriculum, was first developed and implemented in Wisconsin, and now it's in Minnesota. So I have some information from both. Most of the dairy workers have been about 5 years in dairies, but we can find workers that sometimes are there for a week, they have just started, sometimes just a month, and then there are some workers that have stayed longer. And about 67% have not had training on health and safety. And 26% about they have been injured at work. Okay, this curriculum, training curriculum, called Seguridad en las Lecherías en español, Safety in Dairies in English, was developed with the consultation of several stakeholders, several groups that have an interest on health and safety in dairies, beginning from dairy workers and the producers. There were several meetings with them, trying to get the input, what will be the best way to bring the trainings to the workers. There were also professionals from dairy producers in Wisconsin. The Mexican consul in St. Paul was also involved, an organization called Puentes, in English, Bridges. They work with producers and with workers, and River Falls at the University of Wisconsin. And here are the names of the people that were involved in developing this training. So this training, before it was developed, it took some time of consultation with the workers, producers, so it's evidence-based. There was a literature review. There were focus groups that was part of the needs assessment. It was taken into consideration who was the audience for these trainings. They are Spanish-speaking, they don't have much experience on dairy farms, and it's really based on picture mostly. There are questions, but it's mostly pictorial, and taking into consideration that many of the workers, they have about an 8th grade reading level. And also considering the culture, right, where the workers come from. Two of UMASH members, Migrant Clinicians Network and the National Farm Medicine Center, were in charge of developing and implementing the curriculum first in Minnesota. The curriculum consists of 5 lessons that deal with different health and safety issues. The first one is general, introduction to hazards. The second one leads with the animals on the farm, cows. The third lesson is about machinery and tools, things that workers use on the farm. And the third one is on workers' rights and responsibilities, because immigrant workers, whether they have documents or not, they also have workers' rights and responsibilities, of course. And the 5th lesson is on chemical safety. The trainings are PowerPoints. As I said before, they consist of pictorials. They are designed to elicit a discussion from the workers. And they have the opportunity. It really provides a space for workers to talk about what happens on the farm. What are the opportunities for injuries? What are the hazards? And they can think. It's really an opportunity for think and to talk and to share experiences and to propose ideas how accidents could be prevented. And they also propose, solutions. So besides the PowerPoints, there are also materials. So here we see, seguridad en palabras. It's in English and Spanish. We have no se lastime, do not get hurt in English. That's a handout on machinery. Also, needle stick prevention. So we have several materials that accompany each lesson. So the workers can read a little bit further after the session is over. When the workers attend the trainings, they sign their names. This is the sign-in sheet. Here we have 3 workers, for example. We write the name of the farm, the location, the date, the time, the lesson number, the topic, what we're covering, the name of the trainer, and the name of the worker. And this is important because farmers retain this sign-in sheet. And this is evidence that the trainings for workers have taken place, which is an OSHA requirement. These trainings, by the way, have been approved by OSHA, but they can also show that, that workers have been educated and they're taking the trainings. So this is important for the dairies. Before and after the lessons, beginning from lesson 2, we do assessments. So it gives us an idea whether there was gaining knowledge after each training. So these are the pre and post tests. What we do, I am one of the trainings, so I go to the farms, and I really like it a lot. So what we do, or what I do, we have, as I said, mostly pictorials. There are 5 questions. There is only one right answer. We give them to the workers. We ask them not to write their names, but to write the answer. I mean, to signal, it can be an X. They have to mark their answer. And at the same time, I put this assessment, the questions, on the screen, because I'm using PowerPoint. And I read out loud each question, and I explain what the question is about. And then I ask them, please mark on the sheet that you have the answer. And we collect them because we analyze. It's important for us to measure the impact of the trainings. When the trainings are over, these are 5 lessons that take place between 12 months to 18 months. Now we had COVID, so it will be longer this time. But after the trainings have been completed, the dairies have the option to have the community health worker program, Promotor de Salud. And that is a worker that is among themselves. If there is a worker that has an interest on the trainings and has leadership and is trusted by their colleagues, by their co-workers, that will be the worker that will be ideal to be a community health worker or Promotor de Salud. And how do they do it? Because we go there, when I go there, I take a PowerPoint presentation with my laptop, with a slide projector, I take all the materials, but we don't expect the workers to do that. So we provide all the materials in print. We give them binders with the same information that I use during the trainings, and also the materials, like in this, for example. So the Promotor de Salud is another worker. They deliver information to the community and is informal. And this is important because there are always new workers in dairies. The turnover is high. And so there will be new workers. Also, they need to refresh the information to the other workers. So the community health workers, besides offering trainings, they also can conduct monthly safety walkthroughs or monthly observations on health and safety. And this is important because they can help to reinforce safety practices among workers, because there is this discussion, right? We have the trainings, we discuss, they talk. It's good to remind them, to reinforce those messages. And they also can serve as a liaison between the worker and management, not as a policeman. That's very important. They don't have more power over the workers. What they have is they enhance communication. So there are hazards on the farm, things that need to be fixed, needs that can be improved. The community health worker can call the attention and they can talk with management and also with the workers. And again, training workers. And they also calls and visits to the farm. We are in communication with the community health workers. So this is the flip chart that we give the community health workers for their use. This flip chart has the same content as the PowerPoints that we use for the trainings. For example, this one, that will be what I show during my meetings, and they will have it there on a binder. And we also want the community health workers to have information on what to tell workers. So there is one page on the back that can help them. They can help them with words, with knowledge, with they are going to start the conversation with the workers. So it's not just one picture. There will be more information for the community health workers so they can talk to the other workers that are watching this printed sheet. So this is another, it shows what's inside. So this just shows the monthly safety walkthroughs, the monthly observations, the communication with the workers that the promotor de salud, community health worker, does, train Spanish-speaking workers, reinforce safety messages, participate in monthly calls. And there are also evaluations that are done. Now, for us, it's very important to assess whether or not there was knowledge gain at each training. And these assessments begin with lesson 2. So this is the data that we have from Wisconsin. We can see lesson 2, the increase in knowledge, because we have this pictorial kind of quizzes for the workers. Lesson 3, so this is the gaining knowledge, lesson 4 and lesson 5. And these are all the lessons. Statistically, the gain in knowledge was significant. And we are seeing the same thing in Wisconsin, in Minnesota so far. And these are some testimonials here from the farmers and from the workers. Some are from Wisconsin, some from Minnesota. And in general, what the farmers and workers say, it enhances the discussion on health and safety, and that's what's important on the farm. And it provides this space, for workers to talk, because they are the ones who face daily hazards on the farm. They're the ones that really know what are the potential sources of injury on the farm. So it's really good because I find that it also empowers the worker because they are the experts and they start talking during the trainings. And some of them, they also say that has increased health and safety for workers. Here in Minnesota, we had a comment just like about 2 weeks ago. One of the dairies posted in Facebook that the trainings assisted with opening up communication about how employees feel about their job, how workers feel about their job. And they recommended this as they put it exceptional tool for any dairy or farm. That was nice to hear. And we can see the other testimonials from the dairies. Here we have the workers. Again, several testimonials. One worker said in one of the trainings here in Minnesota that when we had the training on animal handling, on cows, he said, once I was pushing a cow, but the cow was pushing me. Now, after the training, I know that cows respond to pressure, and that's why the cow was pushing me. So that was interesting to hear, and he was, he was happy about that. Another worker here in Minnesota said, after that training, I feel like learning so much more. Another, like I've worked on this dairy for 7 years. Until this training, I had no idea how to stay safe. Others say we have experience milking, but we don't know all the hazards that the farm has. And they like the photos and explanations. And farmers, again, from Wisconsin and Minnesota, these testimonials, they have expressed that it was a great benefit to the farm in many ways. Very good. I look forward to the questions. Now, last year, what happened last year? We had COVID-19, right? So since April, I didn't go to the dairies. So what did we do? What we did, we developed some materials on COVID-19 in language that was accessible to the farmers and to the workers. That's what we did. And it was in Spanish and English, and we sent it to them. And also we provided information about COVID-19 testing opportunities around the areas. And right now we're communicating on vaccines. So that's what happened last year. And now Jonathan Kirsch, my colleague, is from our project. He's going to talk about the next section on COVID-19. Hi, Jonathan.
Hi, Chela. Thank you, and great job with that. So with COVID-19, we had to change the way that we did trainings. And because dairy farms are isolated geographically and it was not safe to get onto farms, we interviewed farmers to see the impact on producers and workers. So we interviewed dairy farms that had participated in previous and ongoing projects, like Chela mentioned, with National Farm Medicine Center, Migrant Clinicians Network, and the Upper Midwest Agricultural Safety and Health Center, UMASH. And we developed a 17-question survey that was done either by phone or email, depending on the preference of the farmers. And then 3 additional farms were recruited through press release published in agricultural newsletters. So we contacted 76 farms, and 37% of them, about half, elected to participate in the study. And it happened in between June and July 2020, which was, in Minnesota at least, kind of our second peak. And we found in this survey that that 24%, about a quarter, had reported that somebody at that point on their farm had tested positive for COVID. When we asked about the demographics in the farms and their experience, we found that the farms ranged from about 5 to 120 workers, and we asked them where they got their information, and it ranged from the news, health department and hospitals, and the CDC. Less than half the people surveyed said that they felt prepared for COVID. About 68% had a protocol to deal with what they would do in the case of having an ill employee. And 41%, less than half, asked their employers to wear face masks. Now, this was in July 2020, before there was a mask mandate in Minnesota, but when it was being suggested. So next slide. Following that, in February of this year, when we started to have an idea that we were going to have vaccines available at some point, we followed up with some of these farms and were able to get communication with 10 of them and asked them some questions about how they would like to have vaccinations. And we asked questions such as, would you like to have a vaccination team come to the farm and vaccinate all workers in one day, or go to a nearby community center on their own, having the workers go on their own, or have it available at a clinic on certain dates, or to have the dairy take the workers to a nearby location. And for the first 3 answers, 6 of the 10 thought that was acceptable, to have people come out to the farms or go to a health center. And most of them did not want to try to bring all the workers to a nearby location for obvious reasons. They also suggested that, especially with the 2-dose vaccines and the second one having a lot of side effects, making it harder to work, they did not want to have all the vaccines be done on one day so that they don't have too many workers out that following on the second after the second dose. And also they just in general were quite supportive and said, please, yes, the faster, the better.
So we finish. We have Q&A, right?
If there are any questions, you could put it into the chat or Amy can.
Yeah, let's stop sharing your screen now, Chela.
Okay.
And then if you have any questions, we're happy to answer them. Just stick a question in the chat for us. I'll give you a minute here to fill them. Can't believe there's no questions. Is this just because it's the afternoon, last session of the day?
We're also going to have a breakout session, and we can just go into that.
I just wanted to give people another minute to put anything in the chat. So Lauren and Erica, I guess I need a little help. I'm not seeing any questions come through. I'm needing a little bit of help to put folks in the breakout room. So let me just explain what we're hoping to do. Chela gave us, and Jonathan both gave us a number of, I'll explain and we'll go back to that question. Chela and Jonathan both gave us a number of things to think about about workers and in dairies. And so we had 3 breakout rooms that we'd actually like to hear from you and get some input on strategies and challenges. And the topics for the breakout rooms will be worker rights and responsibilities, hazards and injuries on dairies, and COVID-19 risk and mitigation. So in a minute, we will go into those breakout rooms. And the way that it will be set up is that you will be able to choose which breakout room you'd like to go. And for those of you who are struggling to get into a room because you might not have the latest version of Zoom, I can help you, and you can just, if you're having a really hard time, just change your name by right-clicking on your name under participants and put an A, B, or C in there, or put in the chat where you want to go. But we'll walk you through that. We'll walk you through the breakout rooms in a minute. But it looks like we do have a few questions coming through. The first one has to do with something that we've been thinking about quite a bit. And how do you address mental health issues associated with COVID and immigration status?
Well, I could say something about that. We did have a farm that contacted us about a worker who was, in their words, they said it was some uncommon behavior or behavioral problems. And so what we provided information about the places where they could go in order to get some attention. Now, sometimes, and Jonathan can speak about that because he's a physician, but sometimes it's not easy for them to go right away to the doctor because of their immigration status. But there are some places where they can get initially counsel, and they will not ask for any, they will not ask for documents. So we indirectly had to deal with that, just providing the resources to the dairies, and then they had to follow up from there. And that's the case that we had.
One of the big challenges is that there are very few mental health providers that can speak in Spanish, and those are distributed throughout the state of Minnesota, and I'm sure it's the same in other states as well. And so one thing that we're working on right now is developing a telehealth model that will allow people to access mental health resources through telehealth. And I think that that's going to be a major help and solution to mental health in general, along with the challenges of the stigma of mental health and general lack of access.
Thank you. And then Mary Jo is asking about vaccine resistance among the workers. If any of you want to comment specifically on dairy workers.
Since I am in touch with dairy farms, I can say a little. Not much, because I'm not directly in touch with dairy workers now, because I am not going to the dairies. So my communication is with dairy farms, and they are very interested in the vaccines. The query that Jonathan talked about a little while ago, I contacted 13 farms in Minnesota, dairy farms, and 10 responded, and they all were interested on the vaccine, and they wanted to see how the workers would be vaccinated. And so that's what I can say. I have not spoken with the workers directly.
Jonathan, do you have anything to add?
It's a challenging topic that a lot of us are thinking a lot about, and I think that there's probably more emphasis being put on vaccine hesitancy than is healthy, and I think that when it's available, I think people will want to take it. I still think it's a challenge trying to get it to certain populations, and I think dairy, I think in particular it's challenging because having to try to bring a 2-dose vaccine to dairies that have to be made up ahead of time is very difficult, especially if you don't know how many people are going to take it. But I think that people I think that the news about the vaccine hesitancy is overblown, personally, from my experience of hearing about how many people actually do it compared with how many people have hesitation ahead of time when asked if you're worried about it.
So thanks, Jonathan. And just to sort of add, just from MCN's perspective nationally, is that our big issue is getting doses to the workers. And I think that's a question. And we are seeing some hesitancy, and it's really depending on sort of the nationality and ethnic breakdown, actually, which is kind of interesting. But we're also seeing a lot just demand and wanting to get these vaccines. And so Rachel is with the local health department with COVID-19 vaccine available, and wondering how she can connect with dairy farms to plan vaccination events. And so one of the challenges, Rachel, with this is, well, we want to certainly help you, but it becomes hyper local, and knowledge about your communities and where the dairy farms are. But I really we have some resources available through the National Resource Center for Refugees, Immigrants, and Migrants to sort of help facilitate that for healthcare providers, for health departments. But it's because of the hyper-localness. Now, if you're in a health department in Minnesota, I think Jonathan and Chela and Jeff will be all over it to try to help you out. And if you're not, I think I can see what I can do to help you out if you're feeling struggling sort of with your individual contexts. And you can go, I'll have my contact information in here for you.
And I put the link, I'm sorry, it doesn't have a hyperlink, but I'll try to do that, for the National Resource Center for Refugees, Immigrants, and Migrants at nrcrim.org. And we're actually in the process of developing a tool right now that is for health departments to be able to plan vaccination events.
And Rachel's in Wisconsin, so we do have a great partner for you too, between the National Farm Medicine Center, who's very familiar with the dairy farms there, as well as the professional dairy workers of dairy producers of Wisconsin. Those are two groups with some intimate knowledge of the dairies, and I think we should try to link you up, because again, and this is our COVID challenge, right? It's a global pandemic, but so many of the resources and solutions and strategies become very hyper local. So it's all about that networking. Thanks, Jonathan, for putting the National Resource Center for Refugees, Immigrants, and Migrants, the link in the chat box. I'm going to click on here. We're going to go into our breakout rooms really quickly here. Breakout rooms at worker rights and responsibilities in A. I messed this up. I'm sorry. Hazards and injuries are B, excuse me, and COVID-19 risk and mitigation is C. And so I believe that you can go in and assign them yourselves, right, Heather or Erica or Lauren?
Correct.
Correct. And is that up for everyone to select? I can't see what other people are able to see.
So let me read the options again, because you have a few folks that are wanting to make sure they heard you correctly. So A is workers' rights, B is hazards and injuries, and C is COVID-19 risk and mitigation. So you should be able to see a pop-up on your screen that asks you which session do you want to join.
Great. It looks like we're all back, and we thought it would be great to hear from each of the breakout rooms. And we have 5 minutes left. We'll finish it up just maybe really quickly. I think we'll start with the one that I was in with Whitney. Whitney, do you want to just give a brief summary of where we were?
We discussed strategies to help connect workers and their families to the vaccine. Talked a lot about using word of mouth, trusted messengers, combating myths, including around the vaccine, around, I think testing was mentioned, and then also around ID requirements at testing and vaccination sites.
Great, thank you. And Jeff, from your group, who's reporting out?
Carol, are you ready to do that?
Sure, I have the notes here. My internet's a little funky, so that's why you just see the dog. Anyway, we did talk a little bit about infectious diseases, ones that can be zoonotic between people and animals and animals and people. We also talked about the communication barrier between for Spanish, and I think someone put in the comments where Spanish is a second language. It could be Haitian Creole, or they could be another language, because the workforce is changing and not as many are coming from Mexico. But
great, thanks, Carol. And then Chela, was there someone from your group that was going to report back? You're muted, Chela.
Antonella Peña is going to report.
So what we were talking about, we had 2 questions that we asked. One of them was, what are the challenges workers face regarding their rights to a safe and healthy workplace? And Mary, one of the from the breakout room, she was mentioning how some of the employees didn't know their rights at times, and also how, because some of their jobs are very dangerous, so she gave an example of driving stick. Some of them didn't receive training, so that's another thing. And COVID actually just made things more challenging, because she was mentioning how it's kind of impossible to adhere to the requirements, the regulations. If you are working side by side, you're living in communal housing, you are going to be at higher risk of getting COVID. And especially, although some people were asymptomatic and some people had symptoms, she was mentioning how they still had to go back to working at these risky jobs, even though they're living with the health conditions from it. And then question number 2 was, what are some strategies to help address worker health and safety rights? And she was mentioning how community health workers have a unique opportunity to share information, found that oral information is the best form of disseminating information.
Great, thank you so much. I am sticking in the chat box again a link to if you want any of the resources that Chela went over, they're on the MCN website. And then I'm also putting in there our UMASH website as well, just to, that there's lots and lots of resources out there for you. I think I may have butchered that one. Is it umash.edu? I did, yeah. Sorry, I'll do it again. So I don't know if Jeff or Jonathan or Chela, if you have concluding remarks to sort of wrap up those sessions.
Well, before we end, I saw a question about whether we encounter workers who don't speak Spanish during the trainings. And there are workers who speak indigenous languages. And it's a small number, low number. In Minnesota so far is like maybe 1.5 to 2%. And they speak indigenous languages from Guatemala, from Mexico, from Chiapas particularly. And some of them speak Spanish, but not that well. So what we have to, when that happened, we had to do some translation of some parts or talk with them at the end, because we have a limited time of 1 hour. So we couldn't spend all the time on translation. So that's one challenge when workers speak another language. And thank you very much. I thought it was very interesting to hear the questions and also to see the composition of the participants. And I learned in my breakout room about challenges of workers in New York State. So I actually would like to follow up more on that. I know Mary Jo has interviewed workers in New York. Well, I would like to say thank you very much. It has been a pleasure to share my experience in this case as a trainer working with the project, and also to work with the team on implementing the seguridad en las lecherías, safety in dairies, now in Minnesota. And if there is anything else that Jeff and Jonathan and Amy would like to add, that would be great.